All right, Nisha the PA, we are live.
Hi guys, it's Nisha the PA at Dr. Emer's office, and today I have my gorgeous patient, just 1 day post-op. Now, he looks very good, as always, 1 day post-op, and I kind of want to go through the process of what he had done. This is his before picture. You can see he had a little bit of a problem area in this lower abdominal region, and he also, although he had chest implants, he wanted a little bit more definition to the chest. So 1 day post-op, what we did was a mini tummy tuck. We also did HD lipo and internal heating with Rejuvenation to go ahead and shrink wrap this problem area that he had down here, along with fat grafting to the chest and the buttocks. Now, the big thing that you can see in his chest area that, yes, he had the foundation with the chest implants, but he really wanted a little bit more definition, and we were able to achieve that with fat grafting. So now he's well sculpted and more defined up here in this chest region. Down below, let's take a little bit better look at his abdomen. Now, he wanted more of just like a clean, defined look. He really wasn't looking for the sculpted look. So right now, we give him a nice, clean, just more defined abdomen. And I'll kind of show you the before and after pictures of what was done.
There we go. We can see a lift on the chest right there. You guys can tell the top of his chest is much more lifted right now, not as much sagging. Even though we didn't do a nipple lifting gland removal, it still looks amazing.
And this is just 1 day post-op. So perfect. So now, of course, you can't see the fat grafting that we did to his buttocks, but we do have that on live, and we'll show you as he progressed. Right now, he's doing his appropriate aftercare. So yes, he has a little bit of swelling, but remember that swelling is going to decrease, and it's going to decrease faster because of the appropriate aftercare. Right now, he's doing his lymphatic massages. He's going to do his hyperbaric oxygen chamber, his IVs, and all of this will help with his recovery. Now, this might take a little bit longer of a recovery process, but with the appropriate aftercare, maybe 5 to 7 days, and he's going to be able to walk around, shower, do everything that he needs to do. And once again, the swelling that you see, as always, first day post-op will only improve over time. The lymphatic massage that he's getting is going to help decrease the swelling after surgery and continue to help his results kind of improve as he goes along. Now, we want to just take a look. I want to show you a little bit more.
Someone's asking, where are we massaging him? And what is that pipe on the abdomen? They're asking about the drainage. Can we tell them about that?
Yes, so the drain is for, after the tummy tuck, to get deep underneath the skin to pull all of that blood and lymph out of the tissue. That is helping decrease swelling and pain for the patient. Right now, what I'm doing is moving as much of the lymphatic fluid out of the abdominal area as well as the serratus, the side of the body, and moving that towards a drain we have in the back. That drain in the back is letting me take this fluid directly out of the body without needing to have the body process all of that fluid through the lymphatic system. So this is all really just to speed up your healing, and it really does speed it up. We're looking at healing times that are quicker by weeks with this.
Now remember, for the best kind of expedited healing process, we combine lymphatic massage with IV therapy. We also combine it with a hyperbaric oxygen chamber, and all of that is going to speed up his recovery by a week. So literally, as you see him progress, these drains will come out in the next couple of days. The more fluid, the more times he gets his lymphatic massages, less and less fluid will be expressed, and then he's going to continue just to recover quicker.
All right. Can we get a pain level 3 for our patient? Thumbs up, thumbs down. How do you feel? Thumbs up, guys. Our patient is feeling great. We're taking care of him with our aftercare today. If you guys did watch any of our IGTVs from yesterday, you will know we did do face tight to our patient. Our patient is already seeing a dramatic improvement 1 day after. His jawline is under his neck. His double chin is disappearing. And it only gets much better. So someone's asking, did you also do his pectoral implants? No, we did not, guys. Those were in there before he came to us. Let's see. Someone said, congrats, buddy. How long until his drains come out?
So the drains are going to come out. Part of it will be determined by how much fluid he drains every day, but they usually come out anywhere between 5 to 7 days, guys. And now remember, that is with the appropriate lymphatic massages and the rest of the aftercare that we recommend after the procedure. Not only is it important that you go to a provider you trust, but it's also important that you have the appropriate aftercare available to make sure your recovery is speedy and really as pain-free as possible.
How did you do his facelift? We did not do a facelift, guys. We did face tight and neck lipo. That is good. We ended up doing that. It internally heats the skin, tightens the skin, melts the fat away, and then we suck it out with liposuction. We also did Morpheus 8, which is microneedling radio frequency to help tighten his skin.
You can already see that he has improvements in his chin. Of course, he's swollen. He's going to be wearing kind of a brace around this area to help decrease the swelling as well. So even just one day post-op, with a little bit of swelling, you can already see the dramatic improvement in his neck area. So he still has definition here. And then in a couple of weeks, you'll see he's even more defined in this region. We recommend you continue to do things like the Morpheus 8 for the skin laxity to go ahead and tighten that skin. That microneedling with radio frequency, that's going to continue to tighten this area, continue to give him a nice defined jawline, a nice defined neck. And then you'll see kind of as he continues to aftercare for his neck as well with the neck brace that these results will continue to improve. And he's going to look snatched for the summer.
All right. And so someone's asking about how much time off of work, guys. If you're doing a cutting procedure, which is going to have plastic surgery like a tummy tuck or nip lifting glamour, we do suggest 10 to 14 days after care for you. And we will be wearing compression garments afterwards as much as you can to keep your results as best as possible. So that's about how much is this. Everyone is different and requires different levels of treatment to different areas. So you're going to get a consultation with us at emeragecosmetics.com or send us a DM with your full name, email, and phone number. Let's see. Someone's asking, is he single? And our patient looks hot, is what they said. We have a few comments to that. Procedure for lipedema. Yes, guys, we do that. We have had patients for lipedema. We do have some on our YouTube channel, so make sure you check those out. Let's see, questions are pouring in. So how many days one needs to wear compression garments?
So you only really need to wear the compression garments for about 3 days. After that, you're really all good to go. Now, of course, if you're doing your aftercare, it's going to speed it up and you're going to heal a little bit better. But about 3 days of the compression garments, you get a little bit swollen around the area because, of course, we did a procedure to it. But really 3 days of compression, and then you're all good to go for the face. Just for the face, guys, for the face type. Now, this is a great procedure because we can also do this in office. So
and the body, how long are we doing compression for the body?
So now the compression for the body, we do want you to double compress for about 2 weeks. And that's with the compression garments that we recommend here. But the best results, we always recommend that you compress anywhere between 4 to 6 weeks. And some of our clients just prefer to wear the compression garments at nighttime after that 4 to 6 weeks. And they continue to have amazing results. So ideally 4 to 6 weeks of wearing the compression garments. You can do it a little bit longer at nighttime to really continue to enhance your results.
It says lipedema on the thighs treatment. Yes, guys, that was the video we did, and she did have lipedema on her thighs, and we helped her out a lot. She had great results. All right, guys, thank you for joining us. Thank you, Nisha the PA, and we'll keep you updated on our patient.
See you guys. Bye.
Amazing.